We're going to give an update today on vaccine distribution, on our COVID case counts, and other data. Before we get started, I want to let you guys in on something fun we've been up to this week. Every spring, we surprise the winners of our highest student and faculty awards, our torchbearers and our mace bearer. This year, we've also unveiled a new award for staff, the Volunteer Spirit Award. And earlier this morning, we surprised our very own Dr. Spencer Gregg and someone a little more behind the scenes, our Director of Emergency Management, Brian Gard. Dr. Gregg and Brian Gard have been doing a tremendous job leading our COVID response over the last year. Their dedication to keeping us all safe has been inspiring to watch. And I appreciate so much their leadership, their sacrifice, and their dedication. It is only fitting that they would be the recipients of our inaugural Volunteer Spirit Award. So, congratulations to you, Dr. Gregg, and congratulations to Brian, who I believe is watching this update. We are all so grateful for your work and your commitment to the University of Tennessee. Now, on to today's topics. Dr. Gregg is again joining us from the Student Union, where his team is holding a vaccine event to give the second dose to those who received their first dose at one of our clinics several weeks ago. Dr. Gregg, how's the vaccine distribution going?
Good morning, Chancellor. It's great to be with you again this morning. I do want to express how appreciative I am of the Volunteer Spirit Award, but also want to say that it's definitely been a team effort. And I certainly can't say enough about all the volunteers that have stepped up to make our response so successful, including all of our faculty, staff, and students. So thank you.
Yeah.
And as to the other matter at hand, we are at the Student Union today. We are administering our second doses of the Moderna vaccine. And so far, we've administered about 300 doses and things are going pretty well.
That's fantastic. I understand that the county is opening up a new phase of eligibility next week. Can you tell us more about that and how it impacts our distribution?
Well, you're correct. On Monday, March the 8th, the county will be moving to include providing vaccine to those in phase 1C, as well as the prior phases. Phase 1C are those 16 years of age and older who have high-risk comorbidities or chronic medical conditions that pose them at increased risk of infection or complications of infection. You can find more specific information on the phases of the vaccination plan at the Tennessee Department of Health's website. Now, although phase 1C includes those age 16 and older, on our campus, because we don't receive the Pfizer vaccine for use, which is the only vaccine approved for the use in those aged less than 18, we'll still only be able to provide the vaccine to those who are 18 years and older.
Okay, that's really helpful and it's encouraging also. So now let me ask you about this other news. So what can you tell us about this new one-shot Johnson & Johnson vaccine?
Well, we're really excited that this vaccine is finally available for us. Unlike the Moderna vaccine that we've been using up to now, the Johnson & Johnson vaccine is a one-dose immunization for COVID. And that makes it particularly appealing because with it, we'll essentially be able to vaccinate twice as many people. In the US, this vaccine, which we hope to see soon available here on campus, it was 74.4% effective overall in preventing COVID infection and 72% effective in preventing moderate to severe or critical COVID-19 infection. Additionally, and this is important, in its clinical trials, this vaccine reflected protection against several emerging COVID variants that are of concern.
Really great news. So one more question here. The federal government has announced a tremendous ramp up in production of vaccines over the next 2 months. How are we preparing to help distribute those vaccines through our role, both with our campus and the campus community and our broader Knoxville community?
Well, on campus, we'll continue to provide access to the vaccine through our Student Health Center and through our weekly vaccine clinics at the Student Union. In Knoxville and the surrounding communities, the vaccine will be more broadly available through local pharmacies and some doctors' offices, as well as the county and hospital-directed vaccine clinics. you can go to the Tennessee Department of Health's website where they have a link to a vaccine finder tool so that folks can see all of their available options in their community.
Okay, thank you. Well, this is all really great news, and we're all relieved to know that the turning point in this pandemic is very quickly approaching. So let's talk about our data today. So here's the update. As of this morning, we have 43 active positive COVID-19 cases. Yes, that's 43. 36 are students and 7 are employees. We now have 223 people in quarantine or self-isolation. This includes 113 students who live on campus, 71 students who live off campus, and 39 employees. So let's talk about clusters. We have identified one new cluster since last week's update, this time at the Sigma Kappa House. Like previous clusters identified in sorority houses, this cluster was designated as such because of the particular living arrangements in that house. The cluster includes 2 positive COVID cases and 32 close contacts. We all want to thank the residents of that house for their cooperation with the contact tracing and with quarantining. They're doing just what they're supposed to be doing. Let's talk about now restrictions. Over the last 2 weeks, a number of fraternities have joined the list of houses and residence halls that have had temporary restrictions eased. We can ease restrictions when we have high participation rates with our pooled saliva testing and low prevalence of the virus. I want to quickly recognize them and say thank you to all the students who've been committed to participating in our community testing program. Alpha Tau Omega, Beta Theta Pi, Kappa Sigma, Phi Gamma Delta, Sigma Alpha Epsilon, and Sigma Nu. That's just fantastic. Among the sororities, we are also glad to add to their list the Alpha Delta Pi House and the Delta Gamma House. We appreciate their participation. So now with that, let's talk about our testing data. Last week, we collected 3,444 samples. We tested them in pools of about 3 to 5 samples each. So out of the 840 pools, we identified 17 pools and 79 individuals who were referred for diagnostic testing. Of those who we've tested, we identified 10 positive individuals, all of them residential students. Now, the overall participation rates for residential students dropped again this week to 56.1%. Our positivity rate across all samples was 0.29% of 1%, so 0.29. While a number of our fraternities have stepped up, the overall participation rate has continued to drop every week. And that is just not acceptable. We've got to stick with this and be diligent. In order for us to loosen any more restrictions, we've got to have confidence in our data. And we can't have confidence if we've only got 56% of students participating. Our low positivity rate is not meaningful if people are not participating in the testing. So in order for us to loosen restrictions, we need a participation rate of 75% or more. When a Greek house or residence hall reaches that participation rate, and we maintain a low positivity rate, like the ones I just talked about, we can continue to loosen restrictions. There are some students who have not participated at all. You will be receiving direct outreach from housing, as will your parents, with what you need to do to comply and maintain your housing contract. So now let's look at our metrics summary. As a reminder, this table includes the indicators we use to evaluate whether to tighten or ease temporary restrictions. So here it is. Dr. Greg, I'm coming back to you. How are things trending in our broader community?
Well, overall, we're continuing to see improvement in the number of new cases and active cases, not only on campus, but also in the greater Knoxville community and even across the state. Cases per 100,000 are going down, as are the overall COVID-19 related hospitalizations. That's obviously great news. So we hope to see this continue as more and more people are able to get vaccinated. But we do have some concerns about this given the new circulating variants.
Well, let's talk about that for a minute. So what are we seeing with these new variants circulating? Should we be concerned about the impact they could have on our fight against the virus in our community?
Well, we do have some concerns still across the entire U.S., including Tennessee and our own community in regard to the variants. Because current vaccines may not provide as robust protection against these variants, it's still important to continue to follow the health and safety guidance that we've been encouraging, like mask wearing, social distancing, avoiding group gatherings where these practices aren't being followed, and appropriate hand hygiene. Hopefully, over the next few weeks, we'll have a better understanding of the impact of these variants and how they're impacting our transmission rates. New infections and reinfections are also of concern. But at this time, it's just not clear what impact these variants will have. So we'll have to remain vigilant.
Thank you so much. So that's all really helpful, Dr. Gregg, as always. We will let you get back to your work there at the Student Union. I was over there this morning. I know how busy you are. Before we go today, I do want to talk about commencement. I hope you all saw the announcement last week. It was fun to make and fun to reveal it. It was hard to keep that secret. And I've been excited to finally let you all in on our surprise. And the response has been tremendous. I hope our graduates know I'm just excited as they are to have this special experience in Neyland Stadium. Now, Dr. Zomchik, I know you talked about this last week, but talk a little bit about how does registration for commencement actually work?
Thank you, Chancellor. And before I launch into that, I want to give my congratulations to Dr. Gregg and Brian Gard and all their team as well for keeping us so safe during this pandemic. So everyone, here's how it works. Everyone who's applied for spring 2021 graduation this coming May with the registrar's office, you should have gotten an email inviting you to register online to participate in the ceremony. Now, you must have applied for graduation with the registrar's office to participate. If you registered to walk in the ceremony, but you haven't applied for graduation with the registrar's office, your spot will not be held. So let me repeat that. You have to apply for graduation with the registrar's office in order to have your spot held for our fantastic upcoming Neyland Stadium graduation. So as students continue to register for graduation with the registrar's office, we'll reach out to them about registering for the commencement ceremony. But I want to emphasize that we have limited capacity for these graduations. So if you want to walk in May in Neyland, you need to follow the instructions in the email and register now as soon as possible. Why? Well, we're going to begin opening up any remaining spots that we have to spring, summer, and fall 2020 graduates who have not already walked in a ceremony. We're going to open it up to them this coming Wednesday, March 10th. So they too should receive an email and can follow the instructions in that email on how to register.
Thank you so much. As a reminder, we will have one hooding ceremony for grad and professional students on Friday, May 7th. Then we will have 4 ceremonies for undergraduate students assigned by college on Saturday, May 8th and Sunday, May 9th. We've gotten a lot of questions from those who've registered for commencement about guest capacity. And I know it seems confusing that we have limited capacity in such a large venue. Due to the arrangement of the stages on the field, we can only seat guests on one side of the lower half of the stadium. And because of the need to maintain social distancing, even outdoors, we must limit the amount of guest tickets to 4 per graduating student. This is a special moment for our graduates and their families, and it's extremely important to all of us that we have a memorable and safe experience. I am greatly looking forward to commencement, and I know our graduates and their families are too. So this is all we have today. Thank you, Dr. Zomchik, for being here today. I want to once again thank Dr. Greg and his team for all their work. Congratulations again to him and Brian on their award and to all our award winners this week. Thank you all for joining us for this update. I hope you have a great weekend and go Vols.